Hey folks, welcome back to the Brown Surgery Podcast. I'm your host, Dr. Kenneth Lynch. In this episode, we're going to continue our efforts to provide our listeners with the tools they need to be effective in their roles as educators. Today, we're going to dive into the topic of providing feedback. As you know, this is a critical component of one's professional development. Today, I thought it'd be a good time to review this topic, including how we define feedback in the clinical context, the guidelines on how best to provide feedback to our learners, and also some of the barriers that we encounter around this process. Joining me to discuss this topic is one of our local experts in adult education, Dr. Emily Green. Dr. Green is an Assistant Dean for Faculty Development here at the Warren Alpert Medical School at Brown University. She holds a master's degree in psychology from Boston University and a PhD in adult learning and development from Lesley University, so I thought she'd be a great guest to have on to discuss this topic in further detail with our listeners. All right, so I'd like to welcome Dr. Emily Green to the podcast today.
Hi, Ken. How are you?
Emily, thanks for being here. I think all of us recognize that both undergraduate and graduate medical education has moved towards a competency-based approach to education. And in this system, our learners are expected to reach specific abilities, as Brown calls them, or milestones, as we talk about on the residency side. And actionable feedback from faculty is really key to helping our learners achieve these competencies. So I think my first question to you is, what exactly is feedback, especially when we talk about it in the clinical context?
It's a great question because I think when people think about teaching or they think about medical education, you really picture kind of classic instruction. You picture somebody, a teacher is somebody who stands up in front of a room and expounds on a topic. Or maybe folks think about a small group facilitator, that teaching is about kind of facilitating that discussion. But I think feedback is actually one of our greatest instructional tools that we don't tend to classify as teaching. But it's a huge part of medical education, especially in the clinical years, as you said, when learners really need information about how they're doing. It's a recalibration of something that they, kind of missed the mark, or data about something that they've done well or something that they could do better. And so that reflection of their skills, abilities, and attitudes from faculty is a really valuable tool.
When we talk about feedback, I think there's this misconception that it may or may not be the same thing as a formal evaluation. How do those two concepts differ?
Yeah. In my mind, evaluation has to do with a set benchmark. And then learners are evaluated on, did you or did you not reach the benchmark? So there's kind of a set standard, and then there's an assessment of whether or not that standard has been reached. Feedback, in my mind, can and probably should be much more formative. It should be during the learning process, not limited to just after, the learning has been hopefully accomplished. And it really is a goal in mind of growth, right? So when you give a learner feedback on their skill acquisition, it should be about, all right, you're in the middle of learning this, let's recalibrate you this way or in this direction. And it is much more for the goal of what to do next, how to get better, rather than saying to the learner, you did or did not reach that certain benchmark. That to me is the difference between true, rich, formative feedback and a kind of final summative evaluation.
You mentioned two words there that I think are important: assessment and reflection. How does feedback tie into that loop of self-assessment and reflection with the learner?
I think it's, again, a really important tool for learners to develop that ability to reflect on their own skills, because occasionally you will come across a learner where you have a particular idea about how they're doing, and it turns out that that learner has a very different idea about how they're doing. And then it needs to be sort of a meeting of the minds, right? So then it's a conversation about, well, here is what I see, here is how I think about it. And the learner gets a chance to say, oh, I never really thought about it in that way. And again, it becomes a little bit of a self-correction. I do think that at the level of clinical year med students and certainly residents and fellows, mostly you'll find learners have really, really well-developed senses of kind of self-assessment. They tend to be harder on themselves than faculty are, in fact. And so I think the process of constantly giving feedback and having it be a part of the culture helps learners develop those skills of, okay, I think this is going well. I think I'm doing this okay, but let me check, get that feedback, and then keep moving forward.
I'm going to mention labeling in a second. I think we'll discuss it a bit more, but do you think that we are teaching them self-assessment and reflection when we're giving them feedback, or is it something that we have to point out to them like, hey, during this process, you are going to gain these skills at self-assessment and reflection on your practice?
That's a great question. Does the development of self-assessment skills need to be explicit? It probably would benefit a lot of learners if we made it more explicit to say, we want you to be able to reflect on your own learning. I think when we do that, we develop an identity as a lifelong learner. It probably isn't as explicit as it should be. We don't tend to offer med students and certainly residents much opportunity, much space, mental energy, time to engage in deep self-reflection because just of the time pressures of the clinical work.
Yeah, I think let's take it a step farther, because when you look at the data and the literature on feedback, I think the perception versus the reality of it, if you ask students, they say, hey, I don't receive feedback at all. When you ask educators or faculty, they're like, what do you mean? We give feedback all the time to our learners.
Right.
Why is that?
Partially, it's a labeling issue, right? So I actually, just before the pandemic, ordered, I think 500 buttons that light up that say, I am giving you feedback right now. We don't tend to start conversations with, and here is some feedback. We probably should do more of that to let learners know that, in fact, they are getting it all the time. But part of it is just reframing how we think about feedback. Feedback comes at us all the time from lots of different sources. In the first 2 years of med school, an exam and an exam grade, it's an evaluation, but that grade is a point of feedback where a learner then can say, ooh, I'm not spending enough time on this material clearly because I did not score as well as I, wanted to or needed to. So, there's evaluation feedback, there are, comments from preceptors, there's peer-to-peer feedback that comes through where, it's clear that so-and-so has done a ton of reading that maybe other people on the team haven't done. So I think we need to widen our frame to include lots of different verbal, nonverbal, written, oral feedback that really probably should be labeled as such.
So let's go a step further. I think when you mentioned how we label feedback, especially when we're giving it to a learner, what are some of the guidelines that we should be following as faculty when we're administering feedback to our students and our residents?
Yeah, I think there's a lot of best practices for the giving of feedback, especially if you look that up in the medical education literature. I think the first is really something that we just mentioned, right? Building on a learner's self-assessment and inquiring how a learner thinks that some task actually went. So if you're talking about a presentation they just did, starting off the feedback session with, and how did you think that went? And so I think that A, helps build those self-assessment skills that we just talked about, but B, then provides an opportunity for the learner to really dive into what they think went well or, think they need to work on. I think probably another big area that I would say is to, as much as possible, keep feedback private, to have it be kind of a safe space, to make sure that the learner feels comfortable, hearing that feedback in the moment.
Yeah, so that's interesting. Can you talk to me a little bit about the language that you encourage faculty to use or not use when they're administering feedback?
Language can be really important, as we know, things that we say and things that we don't say. I think our learners are really appropriately so sensitive to the kinds of language that we use. So one thing I would say is try to keep feedback based on behaviors that you've observed rather than trying to interpret somebody's personality. So for example, I always think of the example of the shy student. So if I'm giving you feedback, I would probably try to not say, I know you're shy, but I'd like to see you, speak up more. I would probably instead focus on, Ken, I noticed in small group, you don't tend to raise your hand to participate much. And therefore, I would like to hear from you more. So again, rather than making judgments or interpretations about a learner's personality and kind of who they are, more trying to say, I noticed that you didn't make eye contact with the patient, rather than saying you seemed unfriendly or unapproachable. So again, very behavior-based feedback. I would say the other issue with language is to be really aware of gendered language. So a lot of times we see in narrative feedback around female students, adjectives that don't get applied to male students, like bright or warm, or when we're talking about male learners, we talk about much more kind of concrete things like achievements or intellect. And with female learners, there's a tendency to focus more on their interpersonal skills, which is not to downplay the importance of somebody's interpersonal skills. But when it's the focus and there's a lack of focus on achievement or leadership or accomplishments, then it's a problem.
I've heard the rule of thumb about the timing for administering feedback is somewhere around 72 hours. Can you elaborate on that a little bit?
Yeah, I think timing can be really important. Probably the exact hour difference or time lag isn't that important, but the idea that feedback is timely, that it's given soon enough after again, sort of whatever that learning opportunity was, whatever that skill demonstration was, that it's given soon enough after that the learner remembers all of the details about what they did, why they did it, and all of their, again, sort of self-assessment thoughts about how they performed and what they might do better. So I think the idea that feedback needs to be timely is really important. Too often I hear from medical students that for example, end of clerkship feedback or narrative comes so late that they're already fully immersed in their next rotation. And I'm sure the same is true for residents, that if they have moved on kind of physically, mentally, emotionally from whatever it was, that skill demonstration, the feedback just doesn't have the impact that we, as the feedback giver, were hoping that it would.
I think some of the hesitation for administering feedback sometimes comes down to, I don't know how to administer this negative feedback to this learner. And I think that there's some trepidation there. How does one get to the point of administering negative feedback? And we can talk about some of the methods to deliver feedback in a minute, but should you start with a positive, put some negative comments in the middle, and then go back to positive? Should you start with a negative and then go positive? Is there a best practice for that?
Yeah, people used to do a lot of feedback sandwiches where you kind of hide that negative, meat in the middle of the two slices of bread that are the positives. And we really have kind of moved away from that model at this point. And look, I have a lot of sympathy for that avoidance. I do. I think faculty are human beings. Nobody likes to have awkward conversations. People teach because they love the process of it. And within that teaching role, there's a lot of relationships that are established, that are important, that are trusting. And the people that you're teaching are your future colleagues. And so this is really a relational exercise, and it can feel like you are in danger of rupturing those relationships if you have to deliver kind of bad news, if you have to deliver that negative critique of what's going on. So I totally understand the hesitancy. However, I think when done well, that critique can actually deepen a relationship. If you start with that question about maybe even broaden it from how do you think that went to how are you doing right now, right? If somebody is really struggling, perhaps the feedback conversation doesn't start with that skill demonstration. It actually starts with how are things? How are you doing? What's going on? Tell me how things are going right now. And I think when you give critique from a place of empathy and support and trust, the learner benefits more than when you just sort of hide that negative in between the two parts of the sandwich.
Our learners are working with large teams sometimes, and so information from members of the team tend to trickle back towards a faculty member who might be responsible for administering feedback to learners. Is it okay for faculty to take others' observations of a performance and provide feedback to a learner, or should the feedback just deal with specific performances that they observe?
That is a great question. The ideal is that feedback is based on direct observation, that the person providing the feedback has actually observed the behaviors in question. However, medical education is a really diffuse enterprise. A lot of it is really not centralized. And so you'll have clerkship directors or residency program directors or, chairs of departments who get this information, as you said, from many different points. And I would say at that point, it's pattern recognition. So a one-off, no, probably not, right? Anybody can have a bad day. Anybody can have a relationship where we're just not aligned. You and I are not getting along. Things are not going well for whatever reason. That said, that second report, that third report, that fourth report. Okay, so now we're really talking about a pattern. And I would say, although it might not be ideal to deal with secondhand information, it's necessary. So if, again, in the ideal world, the person could go out and do some direct observation to corroborate certain feedback that they've been hearing, great. But if not, I do think medicine in general is a process of pattern recognition, and I think we probably do the same with our educational processes as well.
We talk about teach back when we obtain informed consent from patients all the time, and certainly our students are part of that process with our residents. Should we be including teach back in our feedback sessions?
So that's an interesting idea. Part of me would take a step back and say, if you are expecting somebody to perform X, Y, or Z, you really may need to establish ahead of time that they fully understand what the instructions are, or what they're going to be evaluated on. So maybe that teach back has to happen actually about the skill demonstration before the learner does the demonstration, so that there's full understanding of, here are the expectations. Do you understand them? Yes, I understand them. This is what I think they are. Okay, yep, we're on the same page. We move forward. I'd be interested, how do you see the teach back process being integrated into feedback?
I think it's helpful, like you said, because you want to have a two-way discussion with learners. I think the fact that sometimes, especially if you're providing them with some negative feedback, there might be some moments there where they start focusing on that negative feedback and they start missing parts of the conversation. So I think it can be helpful towards the end of a conversation to just say, hey, did you get everything we talked about here? Whether you call it teach back, and then also say, hey, here's our action plan. Should you work those into every session, or does it depend on what you're giving them feedback on?
I think so. First of all, I'll say I think you're correct that learners who are on the receiving end of feedback may be kind of hyper-focused either on the positive, and therefore they missed that critique that you offered, or, which tends to be more common really with driven individuals, they hyper-focus on that one critique that you had rather than all of the positives that you mentioned. So I think that checking for understanding, sort of, how are you feeling about this conversation, summarizing the things that you think were important at the end, and making that part of the checking for understanding, I think could be really important. I definitely agree with you that I call it a session, right? But most feedback is not given in an isolated session and shouldn't be. It should be attached to that next time you interact. And so that idea of having next steps or action plans so that this session doesn't live in isolation, I think, again, a very important part of the feedback process. It's not always possible, unfortunately. I think if you're working with somebody, for a week, and you sit down and you have, a talk about how they did, you may not be seeing that same person for a while, but you could talk about, what are you going to bring from our conversation into your next rotation? And maybe that's a way to kind of extend it.
It sounds like that you're really looking to have a two-way discussion when you're administering feedback versus just talking at the learner.
Yeah, absolutely. I think for learners to be engaged in the feedback process, for them to fully take on board what you're telling them, I think it does really need to be a conversation. It can't be that idea of, I give you feedback, you then have to sort of go off on your own and do something with it. So again, that tapping into that self-reflection, how do you think it went? and allowing them to really dive in there can be important. And it can be important for you as the faculty member to fully understand how they are thinking about their own performance. Because again, we talked about sort of the rare learner, but somebody who has a very different idea about how they're doing. And that can be a real problem. You want the giver of the feedback and the receiver of the feedback very much to be on that same page. And the only way to do that is to have it be bidirectional.
Touched on this earlier too, location of the feedback. We work in busy acute care centers. Sometimes it's not uncommon for a learner to approach a faculty member or educator and say, hey, do you have some feedback for me on how I just did there? Where should we be giving this feedback? Should it be done in the middle of a hallway? Especially if other team members are around, how can you get around that? Or should we schedule sessions only in an office-based setting?
Yeah, I think it's probably all of the above. Feedback is so important. It can be in many forms. Ideally, it's private. Ideally, it's a conversation. Ideally, it has enough time for folks to really sit down and kind of engage. But I don't think we should throw out the good in pursuit of the perfect. And so I think hallway conversations are fine. I think a text after a session where you say, great job, loved how you organized the patient presentation, or whatever. I think all of those things can be good tools to use. I think always keeping in mind what were the expectations that I had for this learner, and was the learner aware that those were my expectations. And that should always be the starting point for the feedback.
I think that's important to highlight. When should those expectations be given, right? I think, because I try to talk to the clerkship students, say at the beginning of every rotation, you should really have a good discussion with your team and your seniors of your team to say, what are my expectations for this clerkship? But I think it's important for faculty too to be specific about these expectations up front, so the learners, students, residents do have an idea of what they're going to be assessed on.
Right. Yeah. So early, often, and as concrete as possible, because I think people can only rise to your high expectations if they know what those high expectations are.
You mentioned a while back about the feedback sandwich. Should we be using some of these methods, these prescribed methods? And there's a ton of acronyms out there to help faculty remember the sequence that they should go through when they're administering feedback. Is there one that you like? Should we be using them, or is it just use what's comfortable for you?
Yeah. So I think it's the third that you mentioned. It's use what comes naturally. I think if you some of the acronyms or some of the steps, there are 12 steps that you can go through, and I think they can be interesting to read in the literature, but you're not going to remember those 12 steps in the moment, and much less enact them. So I would say any of the models, the ask, tell, ask, or the Pendleton model that frame it as a conversation are fine. So I would say, again, starting with the learner's self-assessment, an inquiry as to how they think that went, going from there and somehow ending with, like you said, either a check for understanding, a teach back, or a kind of next steps. How are you going to extend this? Anything that comes in between that encourages good, thoughtful feedback would be great.
I think we did a good job kind of summarizing some of the guidelines for feedback. What are the barriers?
Time. It's the biggest one, and it's the one that you're going to hear from every faculty member. Time. I do also think, again, hearkening back to this idea of expectations, a lot of times when a learner is doing well, it's hard for faculty to go beyond the good job, doing fine platitudes, which I know frustrate learners sometimes even more than the critiques, because with a critique, if it is thoughtful and specific and timely, a learner feels seen. Okay, they were paying attention. They watched me. They know how I'm doing. The fine, the good jobs don't have that impact. It may be true, but it doesn't have that impact. And so I think for faculty to query themselves about what am I going to be looking for with this learner? What are the things that I think are important? And it doesn't have to be formal learning objectives. I don't think people feel like they have time to have, written documents with all of the learning objectives that they want for their residents or interns or fellows. But I think that's a process that faculty need to engage in, is a real kind of making explicit those expectations so that they can tell learners what they're going to be looking for.
I think one last piece too, it can be uncomfortable, I think, for learners to approach faculty and say, hey, could you give me some feedback now? What would you say to learners, or some tips you would give them to try to help engage faculty with administering them feedback?
Yeah, I mean, I think encouraging learners to ask for feedback, to indicate that they are open to and wanting feedback is an important thing. It can be an important skill to kind of gain the confidence to approach faculty and say, hey, this is something I'd like to work on. I'd love your feedback on how that went. I will say that can put faculty on the spot, and there may be a tendency at that point to do more of the platitudes, the good jobs, it went fine kind of thing, because you're on the spot. I think my advice to faculty would be maybe a little bit of that's a great idea. You know what, I've got a break in a couple hours, let's go grab a cup of coffee. So giving yourself as a faculty member a little time to really think about what your feedback is going to be, and to kind of craft more thoughtful feedback, to remind yourself to engage in it as a conversation rather than a kind of 2-second, you did fine. That would be my advice to faculty.
Yeah, I think that's a great point too. I think once the faculty get in the habit of administering feedback, even if you can get it on a set schedule, you say, I reserve Fridays between 2 to 3, or I try to carve out some time in that hour to provide students or residents with feedback. I think once you get in the habit and it becomes routine, it becomes a little less onerous on the faculty to provide feedback to learners.
And I think the more we create learning environments in which feedback is just a part of that learning environment, where it's expected, it's not unusual, it's given freely, it's received with thoughtfulness and care and self-awareness, where it really just is a part of the learning culture, I think the better off we'll be. I think faculty will become more skilled at giving feedback. I think learners will be, more able to hear it and receive it and then follow up on it. So again, I would encourage folks who are in roles that help establish cultures, whether it be a departmental culture or a residency program culture, to really think about whether or not that culture promotes, accepts, asks for, supports the giving and receiving of feedback.
Emily, I really want to thank you for joining me today. I think this is an important concept. Obviously, it's a task that we as faculty and educators are responsible for. I think some of us feel much more comfortable administering feedback than others, but I think this discussion should help us work through some of the benefits, guidelines, and some of the barriers to providing our learners with feedback on a daily basis. So
thank you, Ken. This was fun.
I want to thank Dr. Emily Green for joining me today to discuss the feedback process. Down below in the description, I will link an article on feedback that highlights some of today's discussion, along with a link to video resources on feedback offered through the Brown Office of Continuing Medical Education. If there are specific topics you would like me to dive into in future episodes of this podcast, please email me at kenneth_lynch@brown.edu. Have a great week, and I'm looking forward to having you back with us in the next episode of the Brown Surgery Podcast.